the most, I'll say terrifying is probably not the right word, but it was scary and isolating, but also just a lot of feeling like I was in the wrong place. I needed to be on the other side of the door, taking care of patients and not the one in the bed being sick. And so I learned a lot. I saw a lot of things and experienced a lot of things that really made me feel unsafe as a patient. But that had, if I really thought about it, the more I could share the story about what happened, I think awareness plays a big part in how we may not understand how the little things we do as nurses impact patients and impact patients' ability to feel safe in an environment.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here, and welcome back to the Art of Emergency Nursing. I appreciate you being here, and don't forget to leave a rating and review if you haven't done so already. I really appreciate that. That helps the show grow and helps people find the show. People like you, people like people you know. So don't forget to share the show. We always need you to do that. Share it with people you like, share it with people you don't like. Ooh, share it with everybody. Now, I have a great episode for you today. Imagine right now, and right now it's the end of almost 2020, and imagine getting diagnosed right now with COVID-19, or suddenly finding yourself as a PUI, person under investigation for COVID-19. Imagine suddenly finding yourself on the other side of the glass. That's exactly what happened to my friend Deena. Deena found herself on the other side of the glass suddenly when she realized that she very well may have COVID-19. Deena is going to share her insights, what she learned from that hospital visit, and some tips and tricks that may make taking care of your next COVID patient a little bit better experience for them. You are going to love this show, and you're going to pick up some really important tips. So enjoy this show with my friend, Deena.
So I'm Deena Brescher. I am an emergency nurse who loves peds. I will run towards the kids when a lot of people will run away. I know, right? I've been involved with ENA since I graduated nursing school. It was one of those things that we were supposed to do, but really didn't get involved until I ended up in Houston, believe it or not. So Texas ENA is kind of my ENA home. Got invited to a Christmas party, and the rest is history.
That's awesome.
Yep. So I've had a chance to serve in a lot of roles, including in 2014, I had the amazing opportunity to be ENA president, which was pretty awesome, and know Kevin through ENA for sure.
Absolutely.
So for my day job, I work for a software startup. We use artificial intelligence and the ability to read and understand the entire medical record, including free text, to generate clinical decision support for clinicians, starting with triage nurses in the emergency department.
That's awesome.
It's pretty.
But we have an episode on that. We have an episode talking all about Kate and kind of a story of what they're doing. And if you haven't heard that already, you got to go back and listen to it, because it's an amazing episode where you are going to want this software in your emergency department. So let me preface this by saying I got a message from you not long ago, and you said, "Hey, I'm okay, but I'm in the ICU, and just FYI, I'm going to have a lot to talk about this." And I remember being scared, knowing that you were in the ICU, and this was right in March?
Yeah, so I wasn't actually in the ICU. I almost got transferred to the ICU. No, you're good. So it was the end of March. It was probably by the time I let you know, it was April.
Yeah, so you were in the hospital, and you let me know you were in the hospital, and I remember being really worried about you, because this is when COVID was really kind of rearing its ugly head over there on the East Coast, and I was a little worried about you.
I was worried about me too.
Tell us what happened. Tell us
how did
you end up there?
How did I end up there? So part of my job is to travel, and so The last week in February, I had been in Seattle, Tacoma, Portland, Chicago, and I can't even remember one other city, all by airplane. So I had come home, and actually at the airport on my way home, I'm like, oh, my throat hurts. All right, well, here we go, right? It lasted like a day or two, was fine. And then a couple days later started with dry cough, shortness of breath, couldn't walk from point A to point B. And because I had the travel experience right before that, the end of the first week of March, the health department decided that I needed to be COVID tested. So March 6th, I had a negative COVID test. Started to get better and then worse again. And then it was like a roller coaster of better or worse, but it was always about respiratory issues, shortness of breath. I was on a lot of steroids. And towards the end of March, my heart rate I had sustained tachycardia, somewhere between 130 and 150 beats per minute. And so that was what drove me to the ER the second time, which ultimately I got admitted for. But while I was in the ED, they decided, since I had never really resolved my symptoms, and since we in the Northeast had a lot of COVID, they wanted to test me a second time. So I got a second COVID test on the 28th of March. And so getting admitted to the hospital at that point was going to a rule out COVID unit until your test was back, and then you ended up where you needed to go. And at that time, for me, from the ED, it was usually about a 24 to 48 hour turnaround time for the test if you were getting admitted. But at the time they ran my test, it was before labs and CT results and whatnot, I was considered probable discharge. And so my test was in the 5 to 7 day bucket instead of the 48 hour bucket. So the reason that I reached out to you was, it was the most, I'll say terrifying is probably not the right word, but it was scary and isolating, but also just a lot of feeling like I was in the wrong place. I needed to be on the other side of the door, taking care of patients and not the one in the bed being sick. And so I learned a lot. I saw a lot of things and experienced a lot of things that really made me feel unsafe as a patient. But that if I really thought about it, the more I could share the story about what happened, I think awareness plays a big part in how we may not understand how the little things we do as nurses impact patients and impact patients' ability to feel safe in an environment. And so I thought that was important for me to process through, because I'm still processing through that, but to let people know that there are things that are really important that we can do differently to be able to not only support the patients, but also to feel better as a nurse about the care that you're providing.
I think a lot of healthcare providers, one of the things, as soon as you get sick, we instantly go into that like kind of guilt mode. You're like going, I'm not supposed to be going getting sick. I'm supposed to be taking care of the sick.
Yes.
So I'm sure like that just brought your anxiety level, just like, with everything going on, that had to just bring your anxiety level through the roof, being like, okay, now they got to take care of just little old me when I should be the one taking care of other people.
Yeah. So it's as an ER nurse, you have to admit that you're sick, which, that's just really hard to do. Right. Yeah. And then you have to admit you're sick enough to go to the ER. You have to be half dead. I have to be half dead to get there. Right.
Yeah. For an ER nurse to go to an ER,
in the middle of COVID, the tents were up, everything, because we had that experience at the end of March, begin through April and May. So once you're in the room and I'm doing things like, oh, you don't worry about going on the other side of the bed. Let me turn in my bed so that you can reach my other arm so you can start that IV because there's too much stuff in the way and whatever. And you're trying to make it as easy as possible. But when you realize, the door closes and they've just said, yep, you need to stay. And oh, by the way, you're going to the COVID unit. It's very, you feel like you're in the wrong place. Like I need to be like out there, not in here. And then when you realize you're going to a unit that opened just a couple days before. And no one knew what to do yet. And that's completely expected, right? Because this is new for everybody. And so feeling I could be out there helping, and then how can I support the team? What can I do to help them do better? Because they're focused on themselves and their own safety. And that's important. That's really important. But when you hear conversations outside the door, which I heard a lot of those, none of them were positive. And so it really was a lot of conflict, around, well, maybe I won't let you know that I'm feeling like this because I don't know what you're going to do with it. And I don't trust. So I'm just going to keep that symptom to myself for right now, kind of thing. Not smart, but those are the things you think about for sure.
No, I understand. Now, when they originally said, "Hey, you're going to go to the COVID unit," what was the first thought that popped into your head?
Holy crap, I'm sick.
Or did you think, or were you thinking that on your way to the hospital going, "Oh, I totally have COVID"?
No, actually, I was convinced that I didn't. I'm like, there's no way. This has been going on for weeks now, and it gets better when I'm on steroids, and it gets worse when I come off the steroids or we reduce the dose. I'm short of breath, but I'm not as short of breath as the COVID patients are, and so my focus was actually, why is my heart rate so high? Like, that's what I kept thinking about. Like, what are all the things that could be causing my heart rate to be elevated? My lactate came back at 2.4. Of course, I'm like, holy crap, right? Like, what else is happening? But it wasn't until you're locked in a room for a little while, and that you start to put those pieces, at least for me, put those pieces together and be like, okay, so nobody really cares that my heart rate's, between 130 and 150. Everybody cares that I have a pending COVID test. Okay. Well, maybe I should start to care about that too.
Yeah. Wow, that's gotta be tough.
Yeah. And you don't feel well, so already it's, and it was just a very unnerving experience. And again, I just want to make sure everybody understands, there was no one that I met that wasn't doing the best they could do in the moment. And everybody I met was really about self-preservation, which you have to be able to take care of yourself before you can take care of somebody else.
I think that's key. That's key, is that you got to take care of yourself first. And it's hard right now because we don't know how to protect ourselves against COVID.
Yep.
And we know how, but it's not possible. Just when you're whole 24/7 in a mask and, gown, gloves, mask, goggles.
Right. And once the reality of this might be COVID set in, then it became, oh my God, what if one of these people that's taking care of me gets COVID from me?
How much did that weigh on your mind?
All the time, because I'm in the wrong place. I should be taking care of patients, and oh my God, somebody could get sick and potentially die because they took care of me. Oh. And I, why I don't need someone to do that. I gave my own breathing treatments, which is a whole nother story, but it really was, what can I do to minimize the staff's exposure, because I could never live with myself if that was the reason. Even though, if you think about it rationally, if you wear the PPE you're supposed to wear, and you do all things you're supposed to do, you're going to do the best you can to protect yourself. But that doesn't in the moment change the fact that here I am, and here's someone coming in the room to take care of me. And there is a physician at one point who looked at me and said that he knew I was a nurse, because I didn't share that information right till later.
Oh, sneaky.
Couple days. But that he knew I was a nurse, and that I was family to him, and that he was really worried about what was happening, and he wanted to make sure that I got taken care of. And I think that for me was the moment that the reality that, it's looking more and more like this actually is COVID, that sunk in. Because up until then, it was, nobody wants to come in my room, nobody wants to make eye contact, nobody's listening to what I have to say about how I feel, or, and again, all because of what was happening. You hear people outside the door say, why do I have to go in there? Why are they making techs work on this floor? Why can't the nurses do it? Those conversations from the moment I got on the floor, 24/7, by the way, it wasn't any quieter at night. But those were the conversations happening outside my room. So all of those things together really made me feel unsafe. And it wasn't until I got admitted on Saturday. So it wasn't until late Monday morning when I actually had a nurse caring for me who wasn't afraid to think outside of the COVID box. And it was one of the, you don't realize when you have conversations in the hallway how they impact patients. But the flip side happened. I was listening on Sunday to what was happening in the hallway because you got nothing else to do, right?
I tell people that all the time. Like,
yeah.
Your patients have nothing better to do but sit there and eavesdrop on everything you say.
Right. And so I overheard a nurse who was advocating for her patient. She was concerned about a change in clinical condition. She called the physician. I heard the very professional conversation outside the door. And then I heard her agree, yes, she'd call a rapid response. I heard her talk to the rapid response team. I heard her get her patient on the way. And I was like, that's fantastic. Like, yay. And the next morning when I woke up and I was more hypoxic and I was more tachypnic and tachycardic and I felt awful and I was scared. And I had let the night shift nurse know, and her response to me was, somebody will be in for day shift. Well, my day shift nurse I didn't see till 11. So, for 4.5 hours, I was not doing well. And when I heard a voice outside my door, and it was her. And all I could think of was, please, please, please be my nurse today. And so when she walked in the door, it was just an instant, okay, she knows what she's doing. She's not afraid to care for a patient who might have COVID. And she did a full assessment, and she's like, you know what? Yeah, you probably have COVID, but you have this other stuff going on, and we need to take care of that other stuff. Oh. And was able to get things started, which, just made me feel so much more comfortable that when I had to be transferred to, ended up being a negative pressure room, I didn't want her. I'm like, please, can't you keep me for your whole shift? Like, please don't give me to somebody else. Because it was, it all of a sudden I felt safe that I could relax and feel as miserable as I wanted because somebody was there who had the cognitive ability in the moment to know that they were okay and be able to care for somebody else.
Now, you've been in the hospital before. You've been hospitalized mm-hmm. before. I'm assuming. I don't know. But assuming you've been hospitalized before, how different was this visit from the get-go, from the front door of the emergency department to discharge?
Completely different. So the ED process was actually wonderful. It really was. I was isolated appropriately, but that didn't stop me from being cared for as soon as I walked in the door. Nice. And so all the way up through getting to the unit, it was great. What was different was the amount of time that anybody spent in my room was minimal. Mm-hmm. And this is on the COVID unit because at 5 days I got transferred off, but so it was minimal time. Nobody wanted to make eye contact. And silly things like not that I was hungry, but if I did get food, it was ice cold by the time I got it because they were waiting and trying to coordinate care. So they would, bring in a tray at 2 p.m. that's been sitting there since 11 because they wanted to minimize the amount of times in the room. And so
that's when the nurse is going to come in anyway. So
Right. And so, I got all my meds around between 10 and 11 instead of as they're scheduled, just because it was minimizing the time. And so what was different was that I just felt so unsafe, which when you've got a lot of time on your hands and you don't feel well, and remember that I can't have family in the room with me. Can't have friends in the room with me. I am by myself, so there's nobody to advocate for me except for me.
So I've often said that if you're ever in the hospital, what you really want is an advocate, somebody who can just be there and just speak for you, and you can't pick the fights that you want to fight. You want to fight and help fight them. And one of the things we've seen with COVID is, we're not letting families in, so they're not there to do that. So these, like, some people aren't progressing as well because they don't have someone like really saying, "Hey, wait, let's figure this out. Like, this isn't."
Right. And we're so focused on COVID. Like, I could ask anybody who came to my room, and I probably had somebody in my room maybe 12 minutes a day, maybe.
Wow.
I would ask what the plan of care was, and nobody had a good answer for that. But everybody knew if my COVID test was back or not. And so it was really about ruling people in or out. And, the hospitalist before I got admitted in the ER said, none of the subspecialists are going to come see you until after your test is back, which again is, because remember, I thought I was getting admitted for tachycardia. So, it was just a completely different experience. And for me, and part of why I wanted to have this conversation with you is that I tried to figure out, because again, I was there a lot of time, and you can only watch so much TV before you're done, right?
Right.
Is what can I do to help? How can I help support this team so that they feel better about taking care of me and all the other patients on the unit? And so, on the third day, and I was very, I was done by then. A lot of anxiety, a lot of just being scared, feeling alone, feeling miserable.
Yeah.
And so, sometimes if you go and you do something nice for somebody, you feel better about yourself, right? So that's where I was at. And so I thought, these guys probably haven't heard anything positive their entire shift. It's probably been this policy, that change, get dressed this way, don't do this, stay out of your patients' rooms. And so I wanted to send them a message to let them know that they were appreciated. And so when I moved into my negative pressure room, I actually had glass in the door. And they had left a dry erase marker in the room. Even though we weren't writing on the whiteboards, I actually had access to it. So I wrote a message to the staff on the door.
Like, nurses around the world are saying, "Wait, you mean there's a dry erase marker in the room?"
Yes.
It's just
yes.
crazy. Like,
It's
that
totally insane. Yes. And so I wrote a message to the nurses, to the whole team, but I had to write it backwards. So for me, it was an exercise in distraction, because then I could write, you have to think about writing a message backwards. But the only way for them to read it, because I couldn't open the door and write it, was to write it backwards. And so
I can't even imagine how hard that is. Like,
it's not as hard as you think. But what I didn't expect was the response that got. So within 5 minutes of finishing, there were people at my door, and I could hear them. Again, I still could hear everything that was happening outside, even in a negative pressure room when they're standing right outside the door. But how grateful they were, how excited they were, how they were getting their peers to come by and read the message. And it's not like anybody popped their head in and said, "Hey, thank you," which wasn't the point. But I could tell that it actually had an impact. And so I continued to do that until I got transferred. And actually, when they came in to tell me that I was being transferred, the nurses said, "We're going to miss your messages." So, and they asked me to write one more before I left, so I did. But at the same time, we have, especially in the beginning, we continue to say, minimize your time in the room. Put all your things you need to do together and get in and get out, kind of thing.
Yeah, bundle care, get it all done
Correct.
at the same time.
But there's something that got lost in that messaging, and that's the conversation that I had with the nurse manager on the unit, who was gracious enough. I said, she could call me. She doesn't need to come in my room. Like, she doesn't need to get dressed. Like, she could just call me. She came into my room. She spent almost 30 minutes in my room. And we talked about what I was experiencing, but I also validated for her that it's hard to lead right now. It's hard to be a leader when your primary goal in life is to make sure your team is safe. And when that's outside your control, it's huge, right? So for her to be leading a group of a team who up until the week before was taking care of post-surgical patients, and now they have medical patients who are contagious. We talked about how to change that message, how to shift from spend the least amount of time possible in the room is how do we connect with our patients?
Yeah.
How do we make them feel safe and still work to minimize that exposure?
Because I would argue that when you're like this, you guys can't see this because we're on audio, but Deena can see me, and I'm holding a thing in front of my face that would cover where my mask would be. When you're like this and like this, and all you see is your little ninja eyes sticking out, and they're covered by maybe 1 level or 2 level of barrier.
Mm-hmm.
I would argue that it's hard to make a connection, and it's hard to make people feel good. And that's what a big part of what nursing does, is try to make people feel good and try to make people feel safe and cared for. And that's got to be hard. That's going to be hard to do with those barriers.
Mm-hmm.
But my friends in the OR would argue that it can be done.
Mm-hmm. It absolutely can be done. And, I had a phone in my room, but nobody called me to ask questions. And so, they came in to do an assessment, which I will just say that my assessments were completely hands off. And so, but if anybody had called and bothered to do a good history, which ended up happening later after I left the unit, I think the entire plan would have been different. And so you can ask all the questions you need to ask before you come in the room, and then you're coming in the room prepared. So it's not, in addition to writing messages for the nurses that I had, I would write what I needed on the door as well so that they could come. And I had 2 that called me before they were coming in, asked me, the questions that they needed to ask, how I was doing, filled out all the documentation they needed to, asked me if I needed anything, and then let me know when they were going to be in and what they were going to do when they came in the room. And that was, I felt cared for. I felt listened to. It wasn't rushed. It wasn't me trying to not say anything or not be trouble because I could tell you wanted to leave. It was okay.
And what a simple little tweak to just prep for 30 seconds, a minute. To make a phone call, be like, okay, here's the plan. Here's what we're going to do. What do you need before I come in? Like what a simple thing to do that when it sounds like it went a really long way.
It's huge. And when the one nurse that I had, she would make it a point to call me 45 minutes before she was coming in. But if I had any special requests, a small PJ pants was about my only special request I had. She brought, she left enough time so she could still get what she needed to get done, but she could still take care of what I needed before she came in the room. I mean, little things like it was till day 3 before anybody even asked me if I wanted a clean gown or a towel. And I said yes, and the gown they brought me was a bariatric gown. And
you're like, I don't know if you've seen her, but she's not a bariatric patient.
I mean, I'm not a size 0, but I'm not a bariatric patient. And, something as little as that spoke volumes of the fact that we were working on task and not really caring for the patient. And the conversation with the manager was wonderful. And she appreciated the feedback. I really appreciated the fact that she was in there long enough to listen, because the perpetuation of being focused on a task, and I was still in isolation when I left. So it wasn't like I went from, being on strict isolation to not being on isolation anymore. I was still on contact and droplet when I left. But I was still, you could tell the fear level was less because, it probably wasn't COVID. I had a negative COVID test at this point. But the lack of listening to the patient was still huge. And by now I had a lot of steroids. We'll just say a crazy amount of steroids on board. And so
crazy is the key word there.
Yeah, no, it was a crazy amount of steroids. And so therefore, emotionally, I was a little fragile. And so I had a nurse practitioner from pulmonary come in the room, and she walked in and started telling me the plan. And I was like, hold on. Hi, I've never met you before. You have no idea what's happened in the last 5 days, because I can't imagine anybody's charting a whole lot because there wasn't a lot done. But can I tell you how I got here? And so she kind of half listened, whatever, and she left. And then the hospitalist came in and started the same thing, had a whole plan laid out. And I was like, now, obviously in tears because I'm frustrated and I feel miserable, and I've been here for 5 days and I just want to go home. And I asked her the same question, can I just tell you how I got here? And so I shared, everything that had happened and from a symptom perspective and what we had tried and whatever. And she looked at me and she's like, I have a completely different plan now because you shared that information. I said, well, you're the first person to actually listen to what I had to say.
Wow. And
that's when she realized that I hadn't had the tests that I, should have had, and ordered them. I was in echo 10 minutes after she walked out the door. I was then CT. I mean, everything changed when she got involved. And so the ability to have someone who is willing to take the extra 5 minutes it took her to listen to what I had to say and then drive a plan of care that was really trying to figure out why I was having symptoms I was having and what we could do to fix them made all the difference in the world. And anybody that I had met prior to that moment could have done the exact same thing.
Yeah, they all could have done the same thing.
Yes.
And then one of the things that I've always said is there's a difference for caring for people and making people feel cared for. Mm-hmm. And if you can care for them and make them feel cared for, holy crap, you got yourself that's a nurse. That's a nurse mm-hmm. that's going to take care of somebody.
Yep.
And that's a nurse that's going to make a difference. And I remember I used to work with a paramedic, and this paramedic was one of the most personable, nice, sweet, just genuinely kind people. And they were like people he took care of felt cared for. Mm-hmm. And the reality was, in the position he was in and the place where he had the patients to deal with, it was storage. Mm-hmm. There wasn't a lot going on. There was maybe a doc coming in there and seeing him occasionally, but there wasn't a whole lot going on. And they were in like a terrible, like, here's your neighbor over here. If you reach out your hand, you can probably go ahead and touch them. Here's your other neighbor. You can touch them too. They're going to hear some of your stuff. You might hear some of their stuff. And the reality is like that's suboptimal care. Mm-hmm. But he made them feel cared for. And people would leave there going, no, this is great. Great visit. It's perfect. Exactly what I needed. And I'm like going, wow, let's bottle that. How do we bottle that?
It really is. Everybody has the opportunity to do something very small that makes a huge difference. And I never associated those things with with having a patient feel safe in my care. Right.
We tend not to think about those little things mm-hmm. as ER nurses. We're like, yep. Oh, we're way bigger than that. We're ABC, baby.
Mm-hmm. Yep. You're awake, you're pink, you're breathing, you're good. I'm moving on, right?
You're good. Yeah.
And it's eye contact. It's not standing in the doorway, because that tells me you want to leave. You don't care. You've got better places to be, kind of thing. And those are the things that start, once or twice, okay, but repeatedly started to make me feel like, wow, this isn't safe. Like, and if I feel any worse than I do right now, I'm going to have an even harder time. The fact that I finally stood up to say, hey, listen to me. It's 5 days into my visit.
Wow.
But I'm glad that I did and that somebody actually listened, because a couple days later, I had an ENT attending who changed the hospitalist order. So I'm already on my way to CT scan for a study. And I get there and I'm told by the CT tech that it was canceled by this physician I'd never met. So he walked in my room and told me, this is what's wrong and you shouldn't be here, and like all of these things. And my hospitalist advocated for me. I could hear that outside the door too. And I had wished that I was strong enough to walk outside and stand next to her and support her, because she took a beating. It was really inappropriate, and I did report it, but I didn't have the mental capacity at that point to walk outside and walk outside my room and say, hey, you're being a what, and I don't want you taking care of me anymore.
Yeah.
But somebody did, right? Somebody actually did stand up for me and did let him know that she disagreed with his plan of care, and that so did the cardiologist, and that they appreciated his input, but they were going to carry on with the plan that they had created. Yeah. And so there are all these opportunities as a nurse to advocate for your patients. And we walk away from those situations often too. We hear some yelling between two providers or, two nurses, and it's easier to walk away. But I never really thought about it from the patient's perspective when you can hear that happening, that if there is no advocacy on your behalf, you do feel that what am I doing here, and what happens if something happened? There was a point in time where I had essentially I had a near cyclical episode and sitting in bed not doing anything, and I was terrified to hit the nurse call button. Terrified, because I didn't think anybody would come, or that they wouldn't actually try to figure out what was going on. And honestly, I didn't even get a set of vital signs. I did push the button eventually, but so all of those little things really do make a difference. And the only way to be able to provide those to your patients is to take care of yourself, which is a really hard thing to do right now.
Boy, howdy, ain't that the truth?
I'm incredibly fortunate about how things worked out. There were periods of time, and I have a good friend who's an ER nurse who I'm sending messages to about how miserable I am and how much lower my pulse ox is and how much higher my heart rate is. And, and I get the message, did you let your family know? Those are moments where
you're like, don't say that. You know shit.
Exactly.
You know shit. You can't do that.
It's exactly what happened in that moment. And at the same time, I've had experiences in the past where what I remember about them was the little thing that somebody did. The time that somebody put their hand on my shoulder, looked me in the eye and said, you're safe here. Like, you're safe. Like, huge. I still feel that. Like, I still close my eyes and I can feel this person's hand on my shoulder, and how that made me feel so cared for and so much less terrified in the moment. So it makes a difference. But bottom line, if you're not taking care of yourself and you're not getting what you need and taking the time to vent in your own way and decompress, it's much harder to take care of patients. And the reality is the rules are going to keep changing. We're going to keep learning more about COVID. We're going to be changing how we identify patients, how we isolate patients, how we care for patients, the treatments they're getting, the treatments they're not getting. And none of that is going to change. None of that's going away. We just have to figure out how to be able to work through all of those things and take care of each other and ourselves so that we can take care of patients. Because none of us, if it was your family member in the situation that I was in, that's not what we none of us think that that's the right thing for patients.
Yeah.
But we're in this time where it's hard.
Now, here the question I have, and we'll probably never know the answer, but like, did they give you a diagnosis? Because I mean, it sure sounded like it might be COVID, and I got to tell you, I for one don't have a ton of faith in the tests right now.
Yeah.
Because there's a shit ton of people that we see that we're like, that dude's positive.
Mm-hmm.
And then they're like, nope, he's negative. And you're like, bullshit.
My primary provider is convinced I was a false negative. And that's not only based on the hospital course, but the complications and ongoing issues that I've had since I got discharged.
I mean, I said that when we talked. I'm like,
mm-hmm.
When you said, when we were texting a long time ago, you're like, I'm COVID negative. I'm like, maybe not. I don't know. I'm not a doctor.
Right.
Not a
and
scientist.
So we're going to do the antibody test the next time I get labs, which is next Friday. So,
yeah.
At
what point in your stay did you tell them that you were a nurse, or did they figure it out?
The ER team knew because, funny, the attending physician, who I didn't recognize first, because, like you said, just little eye slits is all I saw. He and I had worked on a project years ago when I first came to Delaware. So it didn't register for me initially, and it didn't register for him when he first came in the room, but when he came in later on, it was like, oh yeah. So they knew, and plus, I mean, I literally, like, they had needed to put the IV in my right arm, but my right, the way the room was set up, it was really hard. They were gonna have to move the bed and all this crap, and I'm like, stay there. And I just like flipped myself around on the bed so they could have my arm, like stuff like that. To help, what can I do to help make this easier for you? Yeah, so they knew. But on the inpatient unit, I didn't say anything. I got there Saturday night. I didn't say anything until Monday when the nurse who came in, the angel, the one who actually had advocated for her patient, and she was the voice I heard outside the door when I felt really awful. I let her know, and she in turn let the hospitalist know, the one that actually said that he was worried and wanted me to have a good outcome and all that. I didn't say anything to anybody else, and I don't know that got passed on. The second note that I wrote on the door, I signed a grateful RN or fellow RN. So,
and they're all,
what? And I'll be honest, after the test, my COVID test came back negative, right or wrong, you could tell people were way more relaxed and comfortable coming into my room or chatting with me or any of those things. They were all great people. It just is a situation that was really a challenge.
So one of the things I always ask all my guests, and I'm going to ask you, is I always ask, what are 3 things an ER nurse should always remember? So give me 3 things they should remember about taking care of patients who may or may not have COVID, may or may not feel comfortable. And then what are 3 things they can just go ahead and forget? Like, just don't forget it. Don't do this.
I think, remember that there are people in that bed that are as scared or more scared than you are right now. And so making that connection, taking that extra 30 seconds to make eye contact, to, as much as you might want to get out of the room because you're scared, that sends a message that you don't care, even though that's not your intention by any stretch of the imagination. We're all there to do the right thing. It's just really hard to do that when you're stressed. And so make that eye contact, take that 30 seconds, don't stand in the doorway, really take the time to connect, even if all I can see are your eyeballs, because that's key. And I never realized how much that matters. I think the second thing is the message about minimizing contact in the room, minimizing time in the room is the wrong message. We really need to think about how can we utilize all of our strengths and talents and knowledge to be able to connect and engage, even though I can't be in the room for long periods of time. And there are so many ways and so many silly things, like the one room that I was in, they actually had an iPad. And so the nurse that I had was like, let's try this iPad communication thing, right? And so he wheels the iPad over and it's on a big, tall stick. And so I'm in bed and the iPad's next to me. And even if I put my hands up and wave my hands, he could barely see my fingertips on the iPad because it's just too high. Somebody thought it was a good idea, but didn't think about it from the patient perspective. How is a patient going to use an iPad that's on a 6-foot tall stick when they can't get up and it doesn't come down?
Yeah, the provider is going to be standing looking eye level, but the patient a little lower.
Third thing to hold on to is that you have to take care of yourself. And whatever you need to do that, it's absolutely okay not to be okay. Just need to do something to get back on the I'm headed back to okay path. Because it's really, really hard to take care of patients when you feel like you're not even able to take care of yourself. And from a leadership perspective, it's everything that you've learned about what makes a great leader and how do I prioritize my team or the team I have the privilege of supporting, and knowing that, what you say at shift huddle in the morning may be completely irrelevant and incorrect by the time you get to evening shift huddle, right?
Isn't that crazy?
It is.
Isn't it just crazy? You're like, okay, this is all going to change. And yeah, that's one of the caveats I need to put on like all these podcasts about COVID is, and I think I did on the ones that like talk about clinical stuff, like all this can be completely irrelevant by the time you're hearing it.
Right. And that's the reality. I mean, I remember the moment when Ebola was happening and I was about to get on live TV and talk about Ebola. And in that moment of waiting for the correspondents to kind of set up the story, all I could think about was what I'm about to say may be proved to be completely inaccurate. And I may be sharing information that is going to hurt people. And, but that was the reality that we were living in the moment. And that's the same reality that we're living in now, is that we get more information, we get more results from research studies, and things change and things are fluid. They're not, and you learn what happened. New York learned from Italy, and the West Coast and the South are learning from New York, and we're trying to share those things as much as possible, right? It's easy to feel frustrated that things keep changing. Well, that's the reality, is things are going to continue to change. And when you're trying, again, in that leadership role, you have to be okay with that. You have to be able to make that an okay reality.
Yeah.
Because it is. I mean, we love to change. Emergency nurses, we love change, except when you ask me to change, because then, I don't want to do it.
We love other people's change.
Correct. But for us, we have to be willing to change. We have to be willing to do the homework to figure out what's the right thing, what's the next best way to do what we're doing, because we haven't perfected it yet. And I always said that, we have to continue to work to improve safety in the emergency department until we have zero preventable errors. Well, this is similar in that until everybody survives, we still have work to do.
Yeah.
And that means that last week when I was on shift, and then when I come back this week, it's a completely different treatment plan. Well, yeah, it is.
Yep.
Sure but is. We need to be able to embrace that. And I think that would make things a little bit easier for everybody.
Yeah. The things to forget.
You kind of have to let your OCD go. That perfection is not realistic right now. We're all surviving.
Yeah.
And, you have to give yourself a little grace. And I have a really hard time with that. And I must have been schooled on that since I was in the hospital, probably 100 times, because it's really easy to get frustrated and because you can't do the things that you want to do or have the time to provide the care and all those other things. And we just have to take a deep breath and say, you know what, I'm doing the best I can in this situation. And it may not be pretty, but I'm going to give it my all.
And I would guess just your recovery alone has been like a constant reminder of that.
Yeah. Grace. Give yourself grace. We take that to the bedside too, and it just may not be perfect and pretty, and it may not be, the most beautiful dressing you've ever done in your whole life. But if the wound is covered, then we're good, right? And so, so let that idea of perfection go. You have to let go of stability is probably not the right word. You have to let go of the uncertainty because it's going to be there. And so trying to dwell on it or to figure it out or to allow that to stress you out, it is uncertain. It's all uncertain. And it is our reality now. Yeah. And so we've got to figure out ways to let that go. And the last thing is let go of the notion that even something tiny can't make a difference. You just don't know. You can walk by somebody who maybe looks anxious and put your hand on their shoulder and ask them if you can get them a blanket. And that may be what changes their whole experience or what makes somebody feel safe and cared for. It's not the big things. It's not how quickly you get your IV in. It's, not that you can get the medication out of the little, pill packs and not drop it on the floor. It's none of that, right? It really is about taking that moment to make that connection. And it's not, you have to let go of thinking that you can't do that because you're all dressed up with nowhere to go, right? You can do that. I've spent a lot of time looking at how creative different groups of nurses and providers have been during COVID. And, pictures on your gown, like, wow, what a great idea.
Do you think that would have made it? I was going to ask you about that. Do you think that would have made a difference for you? Like, would that have helped?
I think it would have made it easier for me to advocate for myself because, now when I'm looking you in the eye, I know what I'm looking at. But I can't say for sure. It would have been less, especially when somebody wakes you up to give you medication. When somebody wakes you up and it's dark and you just see eyeballs, it would feel more comfortable if I knew what that person looked like. And also, like, people weren't introducing themselves, like basic stuff. So I may not have remembered what your eyeballs looked like yesterday, but I had a nurse that I had for like 2 hours, not even, when I first got to the unit, and then for 4 hours another night. And I hadn't spent much time, she hadn't spent much time in the room. She wanted to be out of the room. And so I didn't recognize her until she positioned herself in the room. And I'm like, I remember you, I did have you. But being able to see somebody's face would have made that easier. One of the other things to consider is how do you involve your patient in their care, right? We talk about family-centered care and, making those decisions. Well, I don't have family anymore, right? Because they're not present with me. Doesn't mean they can't be FaceTimed but I will say that at no point in the 10 days did anybody offer or ask if I wanted them to reach out to my family, nor if I had family, or it was just me, and there was no consideration of support systems outside of just me. But wow. We started thinking, we need to think about treating me differently because somebody actually did an assessment. they had to get approval to start me on nebs because, again, PUI, aerosolization, all of those things. And I had a physician and nurse who were advocating for me, but I had a respiratory therapist who was adamant that I didn't need these nebs. So much so that when they finally said they agreed they would try one, and if it helped, we would come up with a plan. I hadn't even finished, and she said, you make sure you tell your providers that this didn't help at all. And so I said to my nurse, like, look, it's clear that administering this medication makes people uncomfortable, and I get that. There's no reason that I can't do this by myself. And that's when the I'm a nurse thing had that, like, I'm a nurse, like, I can do this. This is not rocket science,
Like,
exactly.
Leave the shit. I'll take care of it myself.
That's how,
you can go away.
That was the agreement that the team came to in order for me to get the treatment that I needed, that I would have to self-administer it. No problem. But there's lots of other ways to engage your patients. And especially, again, when you're trying to minimize that contact time that we may not have asked patients to do in the past, but if they're capable of doing it and willing to participate, it can help to allow you to focus on something else while the patient's able to manage just like they would at home. I mean, I've been giving myself treatments for days before I got there, right? So that wasn't different. But I had that same respiratory therapist about 2 days after I got off of the unit. She didn't recognize me at first, and I didn't recognize her because, again, yes, all I see is eyeballs. But when she looked up from what she was doing and she looked at me, by then I had recognized her voice, and I was just like, she just didn't know what to say, because I think she recognized that she didn't handle that situation well. And now, hey, she gets to take care of me again. And I let it go because, what am I going to do? I don't want you as a respiratory therapist because you were mean to me. No, I get it. The whole thing, one, made me miss bedside nursing, believe it or not. And I do miss it, but I haven't felt that out of place, that before I really got sick. I mean, I was already sick when this started, right? So my goal was feel better and volunteer and go help take care of patients in whatever capacity. I had already reached out to the ED director in my old emergency department. Hey, if you're going to bring per diems on, like, sign me up. I was looking online for opportunities to volunteer. I was getting messages from travel agencies for New York. I had already talked to my boss and said, look, this is one of those times when, we switch back into research and development, which I can participate in, but I have to do this. I have to be able to stand next to my peers and side by side and take care of patients. And so when I just didn't get better, that just was weighing on me a lot. And so, again, because I have friends that help me see things differently, it's how do I make that contribution? And not everybody has to be the one taking care of the patient to make a difference.
Absolutely.
And that was a lesson that I still struggle with at times, but why I was very interested in sharing with you, so that if one person maybe changed one little thing and made a difference for a patient, then it was worth sharing what happened.
That's awesome.
Because it's a way to contribute. Because when you can't be doing patient care at some point in time, but right now my way of helping and supporting is obviously to be there for my friends, but also to share, to support, and to share what I learned to help make this easier for everybody.
That's awesome.
So I appreciate you giving me the opportunity.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.